Now, abused women are being urged to seek help and care at their nearest community pharmacy. The Independent Community Pharmacy Association has undertaken a Safe Spaces initiative. CEO Jackie Maimin joins me now to expand on this. Jackie, thank you for your time and good morning to this. I suppose this is a way for pharmacists to do their part, to play their part in supporting victims and survivors of GBV. Why was this important to you to open up a Safe Spaces initiative?
Morning, Jamila. Good morning to all of your viewers. Yes, I think as we look at the crime stats, we realize with horror the levels of gender-based violence, the violence against our women, our children. It's just reaching absolutely epidemic proportions. So I think as pharmacists, we really are on the front line. And throughout the pandemic, our doors have been open to help and care for people. And so, of course, we have seen some of the results of this violence. And we are extremely accessible and I think very well placed to assist. So together we decided what we're going to do is offer our pharmacies as safe spaces, access to trusted healthcare professionals where your confidentiality is absolutely protected. And a pharmacy is a non-stigmatized environment. You could be going into a pharmacy for anything from a paracetamol to shaving foam. Nobody knows why you're going into a pharmacy. And once you're in there, you can access your pharmacist, who will always have an ear to listen to whatever challenges you're experiencing.
All right. I mean, when we talk about victims of violence oftentimes, what are the patterns that you have already noted as pharmacists when, they come into the safe spaces? What are the red flags, I suppose what I'm asking, when you can see that perhaps the patient is a victim of abuse?
Okay, so the obvious red flags are things like bruises and where we have to give first aid, but those are the obvious ones. And very often with gender-based violence, those are not the ones that we're seeing. We see things like depression, suicidal tendencies, insomnia, extremely high stress levels and anxiety. And then, of course, there are the blatant ones where people have come in that have been attacked sexually, where we're having to offer emergency contraception or post-exposure prophylaxis for HIV. Those are the really bad cases.
Yeah. And then also, can victims come in and report the incident to you?
Absolutely. So what we're saying to people is, because they are across the country, 3,500 pharmacies. So go into your pharmacy, ask to speak to your pharmacist. So you can't report the incident by us, but what you can do is take those first initial steps. So through pharmacy, we have linkages into the Department of Social Development. We have linkages into the South African Police Services. And, rather than you having to go and stand in a queue at the police station, come into the pharmacy. We can call the police and they can possibly come to the pharmacy and speak to you there.
Yeah. For anyone listening in right now and wanting this, assistance and the safe space, where are you situated? Are you present around the country? Are you national? Can we access you, from rural areas, townships, the urban metros? Where are you, Jackie?
Absolutely. So, Tumela, I'm glad you asked. So we are everywhere. The Independent Community Pharmacy Association, we've got 1,200 members. They are spread across all the provinces in South Africa. And actually 40% of our members are in rural or in township areas. So basically the pharmacy on the corner, pop in there. We're offering you a safe space. Don't keep quiet. And, I think as well, what is so important is the bystanders who may be aware of it. Come in and speak to the pharmacy as well. That might be the first step to getting somebody to come in and talk about the situation that they found themselves in.
For anyone saying go to the police station to report an incident, don't go to a pharmacy only, or don't report it only on social media, why is the safe space significant, at least as a first step? Because you did emphasize that the personnel equipped to assist, medical care on standby. If a victim is not, courageous enough to go to a police station, how can this interaction, medical medically assist them to take the second step, which may be for them to go to the police?
Absolutely. So yes, so come into the pharmacy. We've got clinics, so we can administer any first aid you require. We can give the initial counseling, even if that is just an ear to listen to the challenges you're having. And then, as I say, from there, we've got a list of people that we can refer you to. Do you need counseling? Do you need a safe place? Do you have to get out of your environment where you're living at the moment? Do you need psychological help? Do you need the police? Do you need to go to a hospital? Pharmacies don't carry things like rape kits, but we will be able to advise you where to go. But as I say, it may just be that first step where sitting in the pharmacy, chatting to your pharmacist, we get hold of your family and just move you out of your dangerous environment into a safer environment. That first step of actually speaking about what's happening to you.
Well, I have to commend, pharmacists for not only speaking out, Jackie, but also doing something about it. This is so practical. This is an intervention which can be immediately accessed by anyone. And I have to say that with the scourge that we're in with GBV, I have to commend the work that you're doing. And thank you so much for sharing it with us right here on eNCA.